Live from WKYC Studios, this is 3 News at 5 with Jay Crawford and Betsy Kling.
Welcome back to 3 News at 5.
Thanks so much for spending time with us on this Hump Day Wednesday alongside Betsy Kling. I'm Jay Crawford, and first up at 5:30, there's a good chance a major retail pharmacy chain closed its doors recently, not far from where you live. Hundreds of Walgreens, Rite Aids, and CVS stores are closing shop, leaving many without nearby access to a pharmacist. This week, senior health correspondent Monica Robbins takes a look at the issues from the pharmacist perspective, as this happens to be National Pharmacy Appreciation Week. And their insight might just surprise you.
The days of the corner drugstore are ending. Rite Aid, CVS, and Walgreens all announcing store closures nationwide. Ohio especially hit hard. The reasons are complex, but set drug reimbursement rates from insurance are at the forefront.
It's hard to operate a pharmacy when you get reimbursed below your costs on a prescription drug. And so a lot of operators are closing up pharmacies as a result of that, because it's hard to keep the lights on when you're getting paid less than your costs are.
An issue now being discussed in the Ohio legislature, but even if stores stay open, there's another major problem.
They just don't have enough pharmacists. It's a workforce crisis that's going to lead to a public health disaster for our patients.
Lee Vermeulen is the CEO of the American Association of Colleges of Pharmacy. He says not enough people are going into the field.
We need to make pharmacy cool again as a profession.
I think the chains closing make it seem like you're at risk for losing your job if you're a pharmacist. But there's so much more to the story.
Ohio has 7 pharmacy colleges. Catherine Trump, dean of Neomed's College of Pharmacy, says classes have been thin, but help is on the horizon from some of the chains.
I'm seeing more scholarships for their technicians as well as potential students going into pharmacy school. Walgreens has really partnered with the deans of the colleges of pharmacy to start new initiatives. One of their goals is to increase pharmacy applications by 10%. In the upcoming years.
The trouble is that they're not getting these changes made quickly enough. And what it's doing is it's producing a problem where people don't want to go to work in the chains.
Jessica Awad left a major pharmacy chain because she felt it put profits ahead of patients.
In larger chains, I feel like a big dilemma that a lot of pharmacists deal with is that they go into pharmacy wanting patient care. But a really big issue is that we deal with a very high workload, a very high volume of scripts that we deal with daily. And so as a result, a lot of patient care kind of gets put on the back burner.
She now works at Northeast Ohio-based Discount Drug Mart.
There's never been a day that I've come into work and felt like the patient wasn't the priority here.
While your local pharmacist may be your first interaction with someone in the field, there are dozens of jobs a doctorate of pharmacy can obtain. And yes, your pharmacist is a doctor and the most accessible member of your healthcare team.
When it comes to medications, really nobody gets more medication education through school than a pharmacist does. And so when it comes to understanding how they all interact and what they do in your body and how that they're really the best resource for that.
So I want to go back to explain that set drug reimbursement rate. It refers to pharmacy benefit managers, or PBMs. They're middlemen created to reduce administrative costs for insurers, and they negotiate costs between pharmacies and health plans. They now control about 80% of the prescription drug market when it comes to reimbursements. In February, 39 attorneys general, including Dave Yost, called on Congress to take action for PBM reform. But bills are still sitting in health committees in Ohio and federally. Now, tomorrow, we're going to take a look at today's pharmacist and the misconceptions most of us have about what they actually do. And it will surprise you.
They are represented by a massive lobbyist group.
Absolutely.
And that, literally, from my understanding, that has a lot to do with where we are right now.
You know, but all 50 states have passed some form of PBM reform, but not when it comes, only about 20 refer to reimbursement rates, and there's still not enough. That's why 39 attorneys general said, no, we need to do something more about this. So when a pharmacy says we can't sell you this drug because we don't get reimbursed for it, you know.
It does seem to defy logic.
Yeah, it does.
All right. Look forward to tomorrow's report. Mon, thanks.
Sure.
Well, in today's...
Did you know that the pharmacist at your local drugstore is actually a doctor? Most people don't realize the level of education it takes to become a licensed pharmacist. As we continue Pharmacist Appreciation Week, senior health correspondent Monica Robbins takes us behind the counter at an integral part of your healthcare team.
Did you know that pharmacist behind the counter is a doctor, and they're doing a lot more than counting pills? No one knows more about your meds.
It's another thing a lot of people don't really know. We do interact with prescribers quite a bit. Prescriptions do come over. We're not always sure, should the patient be taking this? Is this the best therapy? Is the dose appropriate? So we are actually in contact with doctors quite a bit.
Jessica Awad is a Discount Drug Mart pharmacist on the front line of patient care. She'll give you your seasonal vaccines, guide you to the appropriate over-the-counter remedies, and help you better understand an existing or new diagnosis.
Maybe they just received a new medication. Maybe they were just diagnosed with a brand new disease, whatnot. That can all be incredibly overwhelming for the patient. So it's our job then as the pharmacist, kind of take a step back with them and, put them at ease with maybe their new diagnosis, kind of walk them through the disease state.
Not only that, your pharmacist can help save you money.
And we get compliments weekly from customers who say, I came in and I talked to my pharmacist and they're so great and they were able to find me this coupon that saved me $100, or they made a switch from this drug that was new and expensive to this one that's been around for a while and isn't, and it saved me $50. And so we see those kind of comments weekly, and that's just one more benefit of that relationship that we have with the patient.
Catherine Tromp is Dean of Neomed's College of Pharmacy and wants you to remember your pharmacist is the most accessible part of your healthcare team.
Everyone goes in the pharmacy profession because we want to care for patients. Even though they're busy back there and it may not seem like they have time for you, they want to have the time for you, and they really do care to make sure that you're as healthy as possible.
Monica Robbins, 3 News.
Monica, thanks. Tomorrow, we're going to take a look at the future pharmacist, what it takes to become one, and the myriad of job opportunities they have access to that include some pretty hefty salaries.
Live from WKYC Studios, this is 3 News at 5 with Jay Crawford and Betsy Kling.
Welcome back to 3 News at 5.
Thank you so much for spending time with us alongside Betsy Kling. I'm Jay Crawford. Well, as we wrap up Pharmacist Appreciation Week, we dive into what it takes to become a pharmacist and the reasons behind the shortage of candidates.
Senior health correspondent Monica Robbins takes us to one of 7 Ohio pharmacy schools to talk to tomorrow's pharmacists.
Third-year pharmacy student Taylin Houston has no intention of working in a drugstore after graduation.
I'm still figuring it out, but I have a strong interest in infectious disease, solid organ transplant, and neuropsychs.
She and her classmates have dozens of opportunities to choose from.
Anything that a doctor can specialize in, a pharmacist can specialize in.
Houston is witnessing the next generation of medicine develop.
There's the field of pharmacogenomics that's kind of coming to the forefront, where they test your genetics and see what medication would be right for you based on those, the results of that. So that's really helping with personalizing the medicine for each person.
Neomed College of Pharmacy is one of 7 pharmacy schools in Ohio. Olivia King graduates this spring. Her dream job is an independent pharmacy with direct patient care.
Hopefully pharmacists get provider status and be able to both prescribe and manage medications and then also dispense them to the patient right there.
Ohio pharmacists have provider status for Medicaid, but not Medicare or commercial insurance. A pharmacist shortage may prompt a change.
I think it's going to change because of all of the chains that are closing. Independents are closing left and right as well. So we're going to run into a pharmacy desert where it's going to be hard for people to get their prescriptions, which is really, really sad.
As of now, fewer pharmacists are entering the field.
When we were at our peak for number of pharmacists that were graduating each year is around 14 to 15,000. Right now, we'll be graduating a class size of around 9,000. So there's been a dramatic decrease.
Despite chain stores closing, it's surprising for a field with so many other job opportunities and lucrative salaries.
Average salary is usually $120,000 to $130,000.
And it's a career that can be started in high school.
You really only need 2 years of prerequisite coursework before you start your PharmD program. So you can have your doctorate degree in 6 years out of high school.
Yeah, do you believe that? When we say high school, we're referring to kids who are already taking college classes in high school. So those who are exceptional in chemistry, biology, and other sciences are ahead of the game. You don't need a bachelor's degree to go to pharmacy school. If you have 2 years of college prerequisite work, you can start, and it also doesn't hurt to have a job as a pharmacy technician in a drugstore, because now the chains are starting to offer up scholarships.
Oh, to help you get through school.
To help you get through school. So,
okay.
yeah, but it's a 4-year college to go through, just like a medical school.
Sure.
So, yeah, and yes, it is a doctorate in pharmacy.
And the responsibility that those folks take on, like when you say thanks, like you better mean thank you, because you think about all the chemistry that a little bit of this and a little bit of that.
They better get it right.
Throw your system off completely.
And it's more than just the folks behind the counter at your local drugstore. These are the people who are making the drugs that you take. I mean, that's just one job they could do. So, I mean, when I say there are hundreds of different jobs that a pharmacist degree or a pharmacy degree you can get into, we're not kidding. There are so many different aspects of this career that these folks can get into. And yes, provider status is key. So a pharmacist can now, in Ohio, can enroll and become a Medicaid provider, but right now they can't provide medication for Medicare or commercial insurance. But because of the shortage, don't be surprised if that
might change.
Yeah,
that's interesting. And also, when you offer a 6-figure salary like that to start, that is also a nice enticement to make sure that we bridge the gap from shortage to having enough.
If you're looking for a degree,
there you go.
There's something to look for.
Hopefully you're good at chemistry too.
Yeah.
Great. Thanks so much, Monica.
Sure.